Good evening, viewers. Welcome back to Let's Talk Knowledge. I'm your host, Jayda Jack, and today we have an impactful topic. Tonight we'll be discussing how to practice safety for kids in physical and social environments. We have an array of guests and experts who will be sharing information on this series of ongoing safety. So sit back, relax, and enjoy. To get us all started, you may wonder, what is first aid? First aid refers to immediate and initial treatment provided to an injured or ill person before professional assistance can be obtained. This practice is crucial as it encompasses various interventions aimed at preserving life, preventing further injury, and promoting recovery in emergency situations. We will now have our first guest, Ms. Murphia, who will be demonstrating for us how to treat a first-degree burn. Dr. Murphia, you have our full attention.
Hi everyone, my name is Murphia Williams, and I'm going to share a few tips with you on how to treat first-degree burns. First-degree burn is a minor condition that occurs when an individual touches or comes into contact with hot objects or surfaces. Sunburn can also be classified as a first-degree burn. First-degree burns are not as serious as higher-degree burns. It affects the top layer of the skin and can be very painful. Your skin may become red and slightly swollen. It may leave a scar if not treated properly. Most first-degree burns heal independently and do not require medical assistance. However, for a child or an elderly person, or if the burn is very large, seek medical attention immediately. First-degree burns can be treated at home by following these tips. Cool the burn by immersing in cool tap water or applying cold wet compresses for about 10 minutes or until the pain subsides. You can apply petroleum jelly 2 to 3 times daily. Do not apply ointments, butter or toothpaste, as these can cause the wound to be infected. Cover the burnt area with a non-stick sterile bandage. Do not prick bubbles. Allow all bubbles to heal independently. You can also take over-the-counter medications such as ibuprofen or acetaminophen to relieve pain and to reduce inflammation.
Thank you for that lovely and insightful demonstration. We will now have Dr. Graham, who will be demonstrating for us how to treat a small cut that is bleeding.
In order to treat a minor cut that is bleeding, wash your hands and put a gauze or cloth over the cut. Then apply pressure to stop bleeding, after which rinse the cut with water. After rinsing, wash the skin with mild soap. After washing, you are going to cover the wound with a bandage or a clean gauze and tape to avoid infection.
Wow, thank you so much, Dr. Graham, for an awesome demonstration. I certainly see some tips that I can apply the next time my child has a cut. We will now turn our attention to Dr. Edwards, also known as the Child Whisperer. Tonight she will be demonstrating how to treat a child under the age of 5 who is choking.
Today, my 5-year-old Leshan and I will be demonstrating how to spot choking in children and what to do. Imagine your child eating or playing with a small object. Then they start to have difficulty breathing. They can't cough. They can't talk. Look at him. The color changed blue. He's holding his neck because he's choking, right? What you should do is be calm. Be calm. You're gonna put your thumb like this. Put your hand like this. Put your thumb near his navel. And put your other hand on your hand that is at his navel. Go in and up. In and up. You know that he's not really choking right now, so I can't do it because I don't want him to vomit. So you're gonna go in and up. In and up. Remember to go down to his level and viewers, remember to be calm. Stay calm. That's the best thing for you and the child. in and up, and then it's gonna come out of his mouth. You're gonna sit it out. And luckily we got it, the what it was lodging his throat out. But in the situation that it can't come out, you have to call for help or send somebody to get help, and be calm until the help comes. Thank you.
That's all for tonight. Dr. Edwards, you certainly are a child whisperer. Thank you so much, ladies, for an inquisitive demonstration segment. I am sure our viewers have learned some tips and skills to practice if they were ever to experience such situations. Let's take a closer look at a live demonstration on how to correctly wear a mask, removal and disposal of a used mask, and subsequent washing.
The proper way of putting on a mask is holding it by the straps, putting it over your nose and your mouth, and securing the straps behind your ears or around your head. Avoid touching the mask. You must, when you are ready to dispose of the mask, you take the straps with your fingers and remove it off your face. After removing the mask, safely place it in a nearby waste bin. Then turn on the faucet to wash your hands. Wet your hands and turn off the faucet to save water. Put some soap in your hands and lather for 20 seconds. Front, the wrist, back, in between your fingers. Make sure to get every place scrubbing properly. Then you lift up the faucet, rinse your hands, but remember not to touch the faucet with your hands again. Use your elbow or a piece of napkin to turn it off. Get a clean paper towel, disposable paper towel, and dry your hands and safely dispose of it in the nearby waste bin. That's all for today. Thanks for having me.
We will now invite some guests to talk about safe and healthy physical environments. Dr. Murphy will be discussing the risk of infectious diseases to pregnant women and the effects it can have on a child. She will also discuss the importance of prenatal care. Dr. Murphy, you have our undivided attention.
Two named infectious diseases that put pregnant women at risk are Zika virus and rubella. The Zika virus is primarily transmitted through mosquito bites and can also spread via sexual contact and from pregnant women to their unborn fetuses. Most infections are mild. However, Zika poses significant risk to pregnant women. It can cause severe birth defects such as microcephaly and other brain abnormalities. Rubella is a contagious disease that can be spread through airborne droplets. It causes mild symptoms in adults but can have devastating effects on pregnant women. If contracted during pregnancy, rubella can lead to congenital rubella syndrome, resulting in serious birth defects such as heart abnormalities, hearing impairment, cataracts, and intellectual disabilities. Despite vaccination efforts, rubella remains a concern in regions with low vaccination coverage. Prenatal care is important for protecting both mothers and their unborn babies from contagious diseases such as the Zika virus and rubella. It provides early detection and monitoring of these diseases, allowing healthcare providers to manage complications. Prenatal care also ensures that pregnant women receive the MMR vaccine. Prenatal care includes regular checkups, education about diseases, and maintaining proper nutrition. This helps to identify and address health issues early to ensure a better outcome for mothers and their unborn babies.
Now let's discuss the impact of poor sanitation on health. Unsafe water and polluted air contribute to diseases such as cholera and respiratory problems. These problems affect children's school attendance and reduce productivity for adults. By ensuring that the water is clean and reduce pollution can help to create a healthy environment for the entire community. We got to do our part. Finally, smoking and vaping have serious risk for both adults and children. Secondhand smoke can cause asthma and developmental delays. On the other hand, health problems in children. It is crucial that adults quit smoking and create smoke-free environment in the home to protect the children's health. Community programs that help people quit smoking and educate about the dangers of vaping can make a significant difference in the families. If you look around, even young children are buying vapes or sending other people to buy vapes, and that's not supposed to happen. Let us stop. Let this be the norm in our communities. Thank you for having me on your show today. Let's work together and keep our community clean and safe.
Thank you for shedding light on this important topic. Your input has been incredibly informative. As parents, we all want our kids to grow and develop in a safe environment. But how can we ensure that these environments are made safe from physical environmental hazards? One effective strategy is conducting pre-licensing site assessments to identify existing hazards. According to Bernstein, emphasizes the importance of proactively addressing environmental issues before a facility opens, which helps to minimize exposure risk. Another critical approach involves implementing comprehensive safety procedures within the preschool setting. According to Pressbooks, Chapter 11, developing strategies to protect against choking, poisoning, burns, drowning, and falls ensures that all stakeholders are aware of safety protocols. Regularly updating safety checklists can further enhance this initiative by promoting continuous monitoring of both indoor and outdoor spaces. Lastly, engaging parents, staff, and regulatory bodies in frequent evaluations promotes accountability and timely identification of hazards. Our focus now shifts to safe and healthy social environments. A group of doctors will be analyzing a video where a 15-month-old infant is brought into the clinic for a scheduled well-child checkup. The mother says that the infant has not been using his arm very much for the past couple of days, ever since he fell off his tricycle. He is behind on his immunizations and has not had a clinic appointment for 5 months. On examination, it was noticed that the infant cries when his right arm is touched. He has bruises on the buttocks, swelling near the wrist of the right arm, and marked tenderness when his forearm is touched. As I too analyzed this video, I have seen some signs of abuse that were very concerning. For one, the crying response when the arm is touched indicates pain that could be consistent with abuse rather than mere accidental injury. Furthermore, the presence of multiple bruises on the buttocks in conjunction with arm injuries points toward potential patterns of physical abuse. And also the fact that the infant has missed immunizations for the past 5 months and has not had a checkup for a significant amount of time raises concern for medical neglect.
So we're going to take a look at other ways that abuse can be inflicted upon a child. So the three areas that were looked at were physical abuse, emotional abuse, and neglect. So let's start with physical abuse. One way that physical abuse can be inflicted on a child is by burning or scalding a child. The second way is by poisoning. For emotional abuse, it can be inflicted on a child by hurling insults at them or even shouting at them, which can make them feel inadequate. For neglect, the way in which this abuse can be inflicted upon a child is by having a child in a dangerous or unsupervised situation. And another way is by ignoring a child's basic needs such as food, clothing, and shelter.
Dr. Murphy will state 3 potential long-term and 3 potential short-term effects of each type of abuse identified in this case.
2 named infectious diseases that put pregnant women at risk are Zika virus and rubella. The Zika virus is primarily transmitted through mosquito bites and can also spread via sexual contact and from pregnant women to their unborn fetuses. Most infections are mild. However, Zika poses significant risk to pregnant women. It can cause severe birth defects such as microcephaly and other brain abnormalities. Rubella is a contagious disease that can be spread through airborne droplets. It causes mild symptoms in adults but can have devastating effects on pregnant women. If contracted during pregnancy, rubella can lead to congenital rubella syndrome, resulting in serious birth defects such as heart abnormalities, hearing impairment, cataracts, and intellectual disabilities. Despite vaccination efforts, rubella remains a concern in regions with low vaccination coverage. Prenatal care is important for protecting both mothers and their unborn babies from contagious diseases such as the Zika virus and rubella. It provides early detection and monitoring of these diseases, allowing healthcare providers to manage complications. Prenatal care also ensures that pregnant women receive the MMR vaccine. Prenatal care includes regular checkups, education about diseases, and maintaining proper nutrition. This helps to identify and address health issues early to ensure a better outcome for mothers and their unborn babies.
We will now speak to Dr. Graham, who will share 3 ways that caregivers can prevent exposing children to abuse.
Hello everyone, Dr. Graham here. So we're going to look at 3 ways that we can avoid exposing our children to child abuse. So the first one is discipline your child thoughtfully. So do not discipline your child out of anger. Use privileges to encourage discipline, because discipline is a way that we can teach our children. So have timeout sessions in order to help our children to regain their control so that we do not discipline them out of anger. Secondly, educate ourselves and others. There are programs in place for both children and adults in order so that we can learn how to discipline children and to take the children away from harm. Thirdly, examine our behavior. So not every conflict with a child needs to be resolved by you. So examine our behavior and see ways that we can discipline our child thoughtfully, because our words and actions can inflict deep wounds on children.
We are coming to an end of this inquisitive episode, but before we end, Dr. Graham will address the importance of culture in ensuring a safer social environment.
From a theoretical perspective, we're going to look at the importance of culture in creating a socially safe environment for our children. So the theorist Vygotsky believed that children learn from their peers and adults, and learning is a collaborative effort. So children will feel comfortable and become confident learners if they see their cultures living with them. So when children experience how to be sensitive and responsive to other cultures, They will create a more harmonious living environment for others and for themselves.
It's been a pleasure having you on the show tonight, ladies. We truly value your time and expertise. To everyone watching and listening, we are so grateful for your support. We appreciate you spending your time with us today. We've had an enriching discussion about child safety and protection, and we are so glad that you could be part of it. Follow us on all our social media platforms linked below to stay updated on upcoming shows. Until next time, stay safe and take care. This is your host, Jayda Jack, signing out on the Let's Talk Knowledge show.